James Haslam is with us. He's the director and lead organizer of the Vermont Workers Center, their website, workerscenter.org. James, welcome to the program.
Hi, Tom. Great. Thanks for having me.
Thanks for showing up. And a tip of the hat to Bernie Sanders' office, who informed us about the great work that you guys are doing. You are building a grassroots, depending on what part of the country you're from, movement to around the concept that health care should be a right and not a privilege. Do I have that right?
That's exactly right, Tom. Yeah, we launched this campaign, Healthcare is a Human Right, in 2008 to build a grassroots network across the state to change what's politically possible for healthcare reform.
Okay, and you're doing this just across Vermont right now?
That's right.
With the hopes, I'm assuming, that other states, other organizations in other states will clone what you're doing?
Well, when we say healthcare is a human right, we believe it's for everybody, but we think that it's pretty clear, and this has worked its way out in the federal fight, that the states are really going to have to lead the way in this country to have healthcare for all, and so we're working our butts off on it, trying to do it in Vermont. We think we have a great chance, partly because of Senator Sanders, who's been doing this work for decades in Vermont, really trying to get the notion that healthcare should be a right. So yeah,
we're talking with James Haslam of the Vermont Workers Center. Workerscenter.org is the website. And James, I lived in Vermont for about a decade, and during that time, the civil unions issue came forward, gay marriage basically, and it went to the Vermont Supreme Court. The Supreme Court looked in the Constitution of Vermont and said, there's nothing in here that says that it has to be a man and a woman. And so they said to the legislature, you guys have to pass a law so that gays can have the legal rights that straight people have, that are equivalent to marriage. And Vermont did that, and Howard Dean signed it into law, and, it's been pretty good ever since, even though it wasn't full marriage, but it was a start. Vermont was one of the very first states, right at the forefront of that. Do you see this leading to that kind of a process, where you're going to have the Supreme Court find this as a right in the Vermont Constitution? Or are you trying to build it in? What's the strategy here? What's the goal? We know the goal. What's the strategy that you're using?
Well, actually, now that we're 2 years into it, we've actually made a lot of progress, and we're at a very exciting point, and we're glad to be on your show so we can help get the word out. Last year, a bill got passed as a result of this work to basically move forward with designing a system on how a state could move to having healthcare be treated as a public good. So a bill got passed. It was called Act 128. We were told headed into the legislative session that it would never happen, but after thousands and thousands of Vermonters got involved and pressured the legislature, it passed with such an overwhelming majority that our right-wing Republican governor didn't even dare to veto it. And what the bill does is it designs multiple options of how a state could have a universal health care system. And it includes our human rights principles. When we say health care is a human right, we actually mean, we have specifics of what that would mean, and there's principles of, that it should be universal, that it should be equitable, and that it should be accountable and transparent to the Vermonters, to the community that it serves. And so those principles are in the bill. The guy designing the system and his whole team is probably one of the most qualified people in the world to do this, a guy by the name of Dr. William Shao out of Harvard University. But this is the guy that was the architect of the Taiwanese system that is a single-payer system that was created in the 90s and is now seen as one of the world's best healthcare systems. So he's actually the person that we're consulting with on the state to design these systems. We'll have the designs of a single-payer system and some modifications around that of how we could have a system that works, given the sort of the mess that we're in now. How do we have a more simple system that works for all Vermonters? And we'll have that for February. And so we're going to be pushing forward and have a really amazing opportunity this next year to start implementing a new healthcare system in Vermont that hopefully will be a model for the rest of the country.
Right. And it will be a variation on a single-payer healthcare system?
Well, there's the bill that got passed. It has three general options, and there'll probably be a bunch of different variations, and all of them are supposed to meet these human rights principles. The first option is a pure single-payer system. The second option is more of a robust, true public option, where and then the third option is what Dr. William Shao calls a modified single payer. So, very close to being a single payer, but, possibly with a few different other revenue streams, but coming out of the same payment spout is what he called it. It's sort of technical, but what we're really pushing them to do is move dramatically towards having a real healthcare system that is treated like a public good for all. So, the healthcare is there based on how people need it, not on what they can afford.
Right. It just sounds like a rational thing. And, the United States is a signatory to the United Nations, and the United Nations Declaration of Human Rights says explicitly healthcare is a right, not a privilege. I'm surprised because our Constitution says that treaties are the law of the land, and we signed the treaties that created the UN. I'm surprised that there's not some force of law behind that and nobody has pushed on that. Do you know anything about that?
Well, yeah, there has been some effort recently in this country. The United Nations has come in, and there's been some special hearings that have happened on this question just in the last year. So,
that's fascinating. Well, we need to push that even more. James Haslam, the director and lead organizer for the Vermont Workers Center, the website workerscenter.org. If you live in Vermont, get out there and help. If you live outside Vermont, look at what they're doing and see how you can do it in your state. James, thanks for being with us today.
Thanks, Tom.
Great talking to you. Good luck.
You're listening to the Thom Hartmann Program.